Hello everyone, my presentation today is a public patient involvement and engagement study, PPIE, on digital storytelling intervention for people living with cardiovascular diseases. It was supported by funding from the European Union Interreg VA and supervised by the University of the Islands and Islands. My name is Adewale Samuel Akinashu. Today, I will be presenting on four main outlines: what the study is about, how we went about the study, the outcomes of the study, and what the outcomes tell us. Behavior change is a major challenge among cardio-rehabilitation patients. There is evidence that behavior change could reduce cardiovascular disease pathogenesis by 50%. Behavioral risk factors have significant impact on cardio recovery. The focus of this study is therefore to apply digital storytelling intervention on cardiovascular disease behavioral risk factor modification. The study method used a user-framed design and a qualitative data collection approach. Two fictional character stories on real-life challenges and recovery intervention were discussed and preferred by cardio-rehabilitation participants. The study also collected data from cardio-rehab professionals. The collected data were analyzed. There were 10 major themes. Starting point tells us how behavior change takes place. Activities tells us about the environment in which behavior change takes place. Connection approach, the third theme, elucidates the most appropriate strategies to kickstart behavior change process. Information sources is another theme that tells us about how and where cardio rehab patients source information in various contexts. The challenges theme tells us the day-to-day life of cardio rehab patients in different contexts. The transitioning theme is strategic in that it tells us of inevitable needs to be met in behavior change process. The belong theme is a major element in behavior change. Participants affirmed that behavior change will be difficult without a sense of belonging. This slide is the behavior change journey experience cycle. The journey experience is a major and central theme in the behavior change process. The center of the recovery experience shows the behavior change only starts when an individual comes to the point of self-realization. Before this stage, an individual goes through a struggling cycle of self-discovery. Thereafter, to sustain behavior change, an individual goes through a self-stabilization cycle. These two cycles are non-static and are important for self-actualization in the behavior change journey. Our evidence concludes that 1. Digital storytelling can bring about behavior change in people living with cardiovascular disease by modifying behavioral risk factors. 2. Behavior change takes place through interactive exchange of experiences, good or bad ones, that are woven around shared activities of participants. 3. Behavior change does not take place in isolation. Therefore, patients in isolation or those living in rural areas can achieve change through clustered and digital access to interventions. I want to say thank you for listening.